My name is Holly Vincent. I am here to talk about moral rights to healthcare. Healthcare is a moral right, not a legal one. I want to talk about every human being's moral right to healthcare. Physicians take a Hippocratic oath, which is a promise of faithfulness, a promise to protect their patients' right to confidentiality, and a promise to respect those under their care. There are 4 other principles they follow that all of their patients have a right to. The right to autonomy, or self-determination, means do unto others as you would have done unto you. They're supposed to keep their promises. Then there's justice. There are 2 types. Distributive justice refers to the allocation of resources. The goal is to distribute resources fairly among their patients in a way that causes no harm to anyone, which is also the 3rd principle, non-maleficence. The 2nd form of justice is procedural, which refers to fairness. They also make a promise of beneficence, or to do good. Stark law is put into place to keep doctors honest. Under this law, they are not allowed to refer patients somewhere that they would benefit financially from, especially when it comes to Medicaid and Medicare reimbursements. Medical malpractice laws are also in place for the same reason. People, however, sue for everything these days. Malpractice insurance rates are high, and higher still for doctors who take high-risk patients. Finally, I would like to discuss cultural competency. Every patient has a moral right to health care. That means they have the right to a complete evaluation where their doctor will understand their needs. If that means the office needs a translator, then they should have one that speaks the languages that the majority of their patients speak. In conclusion, to give all patients their moral rights to health care, physicians have an ethical code of conduct, basic principles, a fair distribution of resources, laws they must follow, and a basic cultural competency they must adhere to. When they stick to these principles, laws, and guidelines, everyone gets the health care they deserve. When they do not, the laws are in place to protect the patient. Thank you.